Now, in the fifth and final section of our lecture, Gastrointestinal Neuroendocrine Tumor, we will talk about the diagnosis of the tumor, how we can treat these tumors, and also what are the side effects. So, diagnosis is look for symptoms like abdominal pain, etc. Measurement of urinary or plasma serotonin, 5-hydroxyindole acetic acid, serum chromogranin A levels, plasma neuron specific enolase level, and activin A. So these are some important tests that should be done. Different levels of these different substances are important to find out if the patient have carcinoid syndrome or not. Avoid flushing of the patient. Dietary supplement with nicotinamide, they are very effective. Diuretics are used for the patient who develop heart disease or heart failure. Oral bronchodilators are used for patients who have asthma or breathing problem like wheezing. Antidiarrheal agents, somatostatin analogs, and serotonin receptor antagonists. So all these are the, again, important steps in the management of carcinoid syndrome. Dietary supplementation including nicotinamide, diuretics, oral bronchodilators, antidiarrheal agents, somatostatin analogs, and serotonin receptor antagonist. Antagonists and analogs which are used, we have tryptophan 5-hydroxylase inhibitor, which is telotristat etiprate, 5-hydroxytryptamine 1 and 5-hydroxytryptamine 2 receptor antagonists, which are methysergide, cyproheptadine, and ketanserin. Analogs of somatostatin which are used is octreotide and lanreotide. So these are some analogs and antagonists that can be tried. We have methysergide, cyproheptadine, and ketanserin, octreotide, and lanreotide. Carcinoid heart disease. Transthoracic ECG should be performed. Diuretics are given. Somatostatin analogs, balloon valvuloplasty to open the valve so the blood flow through the valve is improved. Cardiac valve surgery. Side effects are short-term pain at injection site, nausea, discomfort, short-lived, and no treatment interruption. So short-term side effects usually do not require any treatment, any intervention. It's short-term, there is nausea and discomfort. Long-term side effects like gallstone formation, steatorrhea, deteriorated glucose tolerance, other side effects like bone marrow toxicity, hepatotoxicity, autoimmune disorder. So different types of side effects can occur as a result of the treatment, which are maybe short-term, do not require any treatment, long terms like gallstone formations and there is a deterioration in the glucose tolerance test, and then there is steatorrhea, presence of fat in the stools because of the poor absorption and because of the cholecystitis or gallstone. Then the side effects, other little more serious side effects that can be the bone marrow toxicity, toxicity of the liver, and then autoimmune disorders that are dangerous and they cause destruction of the patient's own immune system. And then we have some CNS side effects. Depression can also be present. Interferon alpha is effective in controlling these symptoms. These are side effects. Some other treatment options, we have hepatic artery embolization alone, chemoembolization, para-chlorophenylalanine inhibit tryptophan hydroxylase, peptide radioreceptor therapy, use of radio-labeled microspheres. These are some other treatment options that can be tried, in which we have hepatic artery embolization, chemoembolization, and para-chlorophenylalanine, which helps to inhibit tryptophan hydroxylase. Gastrointestinal carcinoid, which is non-metastatic type, we have SI neuroendocrine tumors. We need wide resection, en-bloc resection of mesentery having lymph, surgery, appendectomy and hemicolectomy, local resection, endoscopic removal, and excision and lymph node clearance. So all these are the treatment options, which include surgical options also. All these are for the gastrointestinal carcinoids, which are not metastasized yet, which are localized, which can be easily excised and removed. So that was all about our topic, in which we discussed in detail about all the gastrointestinal neuroendocrine tumors, which are the different, we talked about the carcinoid syndromes and the management of the carcinoid syndromes and how we diagnose and treat them, and also what's the carcinoid crisis. So thank you for watching sqadia.com.